This is Ashley McKinney, and I want to welcome you to my presentation on cardiovascular health disease. The population of interest that I chose was the uninsured cardiovascular disease patients living in the St. Clair County who were seen as patients at the Easter Seals Community Health Clinic. A survey of the community was performed. The results indicated that the community identified cardiovascular disease and access to health care as some of the top unmet needs. A review of the data identified cardiovascular disease and education as one of the community needs for the reported population. Education is a concern for the selected heart disease population. The indicators relating to the selected population can be categorized by the Healthy People 2020 as access to health care and nutrition, physical activity, and obesity. Generally, Americans do not consume the required intake of fruits and vegetables. Over 80% of adults do not exercise at the recommended amount. Furthermore, 20% of the population have not identified a primary physician or have no access to health care. This increases one risk for heart disease and complication from that disease. There are 5 sub-roles and interventions of the advanced public health nurse. As the practitioner, the advanced public health nurse seeks to implement evidence-based practice as it serves the patient, family, and community. In this role, the nurse is able to identify areas for research. As the administrator, the nurse is provided with an opportunity to serve as an overseer, decision maker, and a problem solver. This can involve direct or indirect patient care. Usually, this particular person is in some type of supervisor position. The educator focuses to identify population and provide health education and interventions for that selected group. The advanced public health nurse increases the population awareness of diseases and how to address modifiable risk factors associated with those diseases. As a consultant, the advanced public health nurse may operate as an informal or formal consultant to the patient, family, physicians, and/or other healthcare workers. This would include assessing problems, determining the availability of resources, proposing solutions, and assisting with implementation of a solution. As the researcher, this involves application of research process to investigate problems that may arise in the clinical setting. The data obtained from the research could be used for healthcare policies or integrated into healthcare practice. In serving the population of interest, I was able to perform these 5 sub-roles in the clinic that I served. I offered suggestions where applicable for improvement in providing evidence-based practice to the patient and family. I identified areas clinicians reported as a problem and sought to bring a resolution to those areas of concern. I utilized those resources for patient education on heart disease, its complication, and lifestyle changes. I also engaged in interviews with patients to identify barriers the patients may have been encountering. Furthermore, I linked the patients and their families with resources in the area. There were 3 scholarly articles that were reviewed. One showed a correlation between patient barriers and their health outcomes. Another one showed how policy can have there was a positive correlation between policies and public adherence to the recommended guidelines. The last one was prevention of cardiovascular disease and how it involved everyone, not just the patient, but healthcare workers and their families as well. Upon review of the literature, the factors that increase cardiovascular disease were financial barriers, disregard of clinical guidelines, and underutilization of resources available. This is just a summary of that rapid appraisal checklist. As you notice, Article 1 has the strongest level of evidence. There are primary, secondary, and tertiary prevention efforts that contributes to how the advanced public health nurse deliver their care. The initial onset and development of cardiac disease can be difficult to determine, and resources can be limited for patients. For the clinic that I was at, primary and secondary interventions were deemed to be the most effective and practical, based on literature and based on what I saw in practice. The most effective interventions within the sub-roles was that as a clinician, I served the patient by providing latest evidence-based guidelines as it relates to his or her clinical manifestations. It was very personalized care that we gave. The administrator, I determined any inconsistencies in the treatment plan, and I'm going to help monitor compliance. I sought as an educator to provide patient with applicable information so that the patient may better manage his or her disease. Everybody kind of comes in with similar conditions, but yet they have a unique twist to them. So being able to provide education for that and to be able to talk to the patient was about that actually was very beneficial, and it helps personalize their healthcare experience. As the consultant, I identified barriers that the patient was experiencing and connected them to appropriate resources. There were people who had trouble with their medicines and paying for those. Just talking to pharmacists, talking to certain physicians, talking to actual drug companies, and sending information to them to help patients obtain their medications or obtain any resource necessary was one of the ways that I was able to fulfill that role. As a researcher, I evaluated and assessed the regimen that the patient was following. So we did follow-up calls to patients consistently, and sometimes we had them calling us almost on a weekly, some patients almost on an everyday basis, just to kind of make sure that they were able to follow the plan for their care. Thea Johnson developed the behavioral system model. In this model, she showed how nursing contributed to effective behavior function in the patient at all points of the illness, before, after, and during. This combination of art and science of nursing aided the nurse in fulfilling the role he or she played in stabilizing and restoring the person's behavior system. A summary of needs assessment. As we mentioned earlier, that literature and community surveys identified a need for cardiac disease management and education. This initial onset of the development of cardiac disease is difficult to determine, as some research shows that you can determine that patients have cardiac disease even in embryo. So the initial onset is difficult. The risk for cardiac events can be reduced by management of risk factors, chronic illnesses, early screening, and lifestyle modifications. The priority education plan for this population was to teach patients about treatment options, medications, and the lifestyle choices to assist in improving the outcomes of one's health. The proposed plan was to create visuals for the patient, give the patient a deeper teaching of the prescribed medication that they were administered, and then answer any questions and allow them to respond and to do a return demo of the knowledge that was given to them. A copy of the discussion was taken home, and in this discussion, it included information about how to manage a particular disease. It also included common medications that were seen in the patients with cardiovascular disease. So when it came to certain beta blockers or certain like aspirins or blood thinners for some of the patients that needed an actual blood thinner, or when it came to cholesterol lowering agents. The medication and lifestyle changes works together in the management of chronic illnesses. That was the key point, and what we were trying to help address the patient. It's not so much of us just giving them a particular prescription for them to fill and not do anything else, but their lifestyle actually contributed to their health outcome. Easter Seals Community Health Clinic is a new clinic. It was started actually this year in July. In 2017, a group of nurses identified limited resources to uninsured people living in the St. Clair County. That core group started this process toward opening the clinic geared towards this population. They visit certain seminars, conferences, just Memphis. They modeled some of the things after certain other charitable clinics just so that they could provide something for this community. The clinic opened the doors for service at the end of July to uninsured patients, adults particularly, 19 through 64 years old. It is connected to St. Vincent's Hospital in Pell City and various other facilities in the area, as we will see later on in this presentation. There are significant trends and events. Health disparities are seen amongst people with different financial status, ethnicities, and geographical locations. Government, as we mentioned earlier, does play a role in public adherence to how we adhere to clinical guidelines. These are just some of the government officials in St. Clair and in Alabama as a whole. Some of the key leaders, as we mentioned earlier, with it being St. Vincent St. Clair, the hospital that is in the St. Clair County, the Health Department, Jefferson State Community College, and as well as Stanford University. The U.S. Congress and Representation, this is who makes up that representation, and it's consisted of Democrats as well as Republicans. One policy that has been introduced to the House is creating opportunities now for necessary and effective care technologies. This particular act seeks to take advantage of the capabilities of technology. It's seeking approval for services to be offered as a standard package with Medicare plans. The last status on it was seen in the subcommittee on health, where Diane Black was the sponsor for this bill. There are two other policies noted to be involved in my population of interest to improve the health of the community at large. The first policy is improving the health by increasing minimum wage that was placed in 2016. This policy notes the health disparities among those who are living around the federal poverty line. The next one was supporting the updated National Physical and Activity Plan. This policy was placed in 2017. It seeks to promote a change in multiple sectors. These sectors are businesses, healthcare settings, sports organizations, faith-based organizations, really any organizations in the area, just to kind of really push for people to become active. Literature reports that factors that increase cardiovascular disease are financial barriers, disregard to clinical guidelines, and underutilization of resources. And with many of the adults not exercising regularly, these are guidelines that would hopefully help the public to adhere better to. The ANA Code of Ethics. In Provision 8 of the Code of Ethics for Nursing, it states that nurses collaborate with other healthcare professionals and public health to protect human rights, promote health diplomacy, and reduce health disparities. This responsibility as a nurse guides the efforts for nurses to engage in the outreach initiatives, track laws, and advocate for the affected population, which is something that I feel like the clinic that I'm serving at is really taking a stab at. Health policy advocacy. This is taking steps toward including increasing awareness and disease management through education, participating in legislative efforts, and collaborating with other disciplines to address barriers to health. There's demographic and socioeconomic characteristics to St. Clair. It is made of majority white Americans, with Black Americans coming in second at 9.4%, and then less than 5% of the other races. That includes like your Asians and your Hispanics. There is over 15% of the household that lives below the federal poverty line, and more than 12% of the people are uninsured in the county. In addition, as mentioned earlier, St. Vincent St. Clair is the only hospital in that particular county. Air quality does not meet the national benchmark. Some of that could be due to the fact that there's such a heavy smoking in the area, which that's over 27% of the population, and then just there's construction as well as other environmental hazards. There is 33% of the adults over 20 report that BMI is over 30%, that they do have obesity, which goes back to the Healthy People 2020 indicators. And then, as we mentioned earlier about heart disease being the leading cause of death, cancer also kind of runs neck and neck with that for this particular county. A windshield survey was performed of the Pell City area. They are incorporated into St. Clair, so they've been around since the 1800s. There's many construction areas as noted, as I previously mentioned, and there's limited access to health and limited areas for walking, which kind of going back to Healthy People 2020 for improving access to health care and improving nutrition, physical activity, and obesity. These are just some goals that this county really can benefit from. 3 people were interviewed, and these are 3 different people. One is actually in a clinical setting, one is in a hospital setting, and the other one is actually in the community. And what you can see is that in the clinical setting, there is a shift in healthcare that is deemed almost a little negative because of the fact that providers won't be able to spend the amount of time that they would be with patients because of the demands that insurance companies are placing on those particular reimbursements in order for them to get their physicians to get their reimbursement. So you're going to see a decrease in their primary care doctor presence in the hospital. Whereas on the at the bedside, nurses are believing that this could be positive because it will result in better management of patient care, which results in better patient outcomes. From a community aspect, the community sees it as better patient-centered care. The changes that we're seeing in healthcare, and meaning that there are better outcomes, and that it's causing care to become more efficient. 3 priority community diagnoses were financial barriers, limited access to resources, and education of disease management and resources available. The priority community diagnosis that was noted was adherence to a medical treatment plan. Some feasible population interventions that could be done was just assessing for adherence, kind of evaluating barriers, and then working through those barriers in a one-on-one individualized treatment plan. And at the end, we would evaluate those interventions that patients were able to adhere to. The measurable plan objective was that the nurse seeks to present evidence-based practice educational plan to the patients with uncontrolled hypertension in an outpatient setting to improve the quality of life and decrease complication of cardiac disease. The details plan for the project intervention was that I performed hour-long intake on individual patients that allowed me to evaluate barriers to their adherence and to plan one-on-one care. I did engage in more than 4 to 6 patients because the way the clinic was structured, it just allowed for that to take place. Handouts were given, and I collaborated with physicians and other community resources. At the end, I did evaluate on some of the people that I engaged with, but not all of them due to time constraints. Potential resources that I thought I was going to need at the time was a heart model, but that was not necessary at the time considering we had handouts. I did have access to patients' information and equipment and supplies. And technology equipment, group sessions were not needed or were not held at all. It was more of an individual personal session. And I think that would just serve the patients better. Some of the barriers and challenges with this clinic being unique in the way that it delivers care, and with me coming in to serve the patients in this capacity, many patients weren't familiar and we were not used to getting that type of care. So it was kind of hard for them to answer some of the questions that I asked as far as what did they want to do and how did they think they could change and take advantage of managing their health. There were time constraints just because there was just not enough time to work on a project like this and to see the long-term effects of that. You really need a couple of years on this. Awaiting commencement for other educational classes such as smoking cessation, those classes will not start until the beginning of the year, so kind of waiting for that support group to take place could cause some people to lapse on what was being taught. This is just a list of the team members that were involved. Dietitians was not necessary because there was a nurse practitioner who had education and was a specialty in diabetic education and nutrition, but I did connect to other resources and churches. The key stakeholders that were in this were the uncontrolled hypertension patients living in the St. Clair County who were uninsured. And these are the patients that I had the pleasure of serving. They came with other comorbidities as well, so I was able to just really engage in them and to see certain interventions from all aspects of life, from the moment that they stepped foot to the clinic to the moment that they stepped out of the clinic and were able to do the medical treatment plan that them and their provider discussed. So it was really a pleasure in working with all of them. These are just some of the reference at the end. And that is all of my presentation. So I appreciate you taking the time to listen to me and to see how I serve the cardiac population in this area.